Hi, bentornati. Welcome back as we continue our enlightening discussion on infertility. This is Infertility Part 2 as promised. If you're enjoying this discussion, please pause for a brief moment to give it a like. Share with friends and family members. And if you haven't subscribed, please remember to do so. Your subscription is greatly appreciated and it helps the channel to grow. So replace your thinking cap on and put on your humility as we continue our interesting discussion about conception. So let's continue right from where we left off. In part 1, I outlined some of the pathogenesis responsible for infertility. And just to recap, they are deficiency of the kidney qi, stagnation of liver qi, cold dampness, obstruction, phlegm dampness obstruction, heat retention, and stagnation of blood. Let us now evaluate the pathogenesis given above and how we can relate them to the analogy of the incubator. Pathogenesis number 1, kidney qi deficiency. This simply means weakness and insufficiency of the kidney energy. Symptoms are soreness and weakness of the lower back and knees, lack of sexual desire, tiredness, especially after sex, tinnitus, clear urine, slow pulse, delayed menstruation, scanty menstruation. The principle of treatment is to warm the kidneys and strengthen and regulate the liver blood. This can be equated with parts missing and or insufficient electricity going to the incubator. So the eggs cannot hatch because there's no nourishment going to where it's needed. Samples of herbs used are molasses, noni root, cuscuta, donkey eye. Pathogenesis number 2, liver qi stagnation. This means the energy of the liver is not flowing freely within its pathways, which traverses the lower abdomen into the hypochondriac region, into the breast, and into the head. Symptoms manifested are mental depression, irritability, irregular menstrual cycle, up and down emotion, amenorrhea, breast and lower abdominal distension, headaches, mostly around the periods. In this illustration, the syndrome can be equated with irregular surges of current going to the incubator because someone is turning on and off the current. Some examples of herbs used are nutgrass, orange seed, zebrafarm. Pathogenesis number 3, cold dampness retention. This indicates the womb is cold and damp. Symptoms are delayed menstruation, coldness in the lower abdomen, a tendency to feel cold easily and to crave warmth, cold limbs, copious urination, copious clear urination, watery vaginal discharge, painful menstruation, dark purplish in color, and a deep slow pulse. In the illustration given, this indicates there is no electricity and the incubator is cold. Whenever sperm is released into the female reproductive organ, it's as if they freeze in there. The ancient had a term for this, frigidity. Many of you older ones will remember. This type of syndrome may be often found in women who sit on cold places, especially during menstruation, or in women who work in very cold environment. Women who wash in rivers, especially during menstruation. During the periods, the pores are open and pathogenic factors like coldness, wind, and dampness may easily enter the body via the pores. In Japan, there's a female disorder called air condition syndrome. That is, women being affected by AC. Like I said, common sense always triumphs if we allow it to guide us. Some useful herbs are cinnamon, roasted ginger, and fenugreek. Many of you women will notice your periods give problems when the place is cold or you are in air condition. Pathogenesis number 4, phlegm dampness obstruction. This syndrome is often found in persons who relish eating a lot of deep fried foods, other types of fast food, sticky, greasy food, and a penchant for drinking cold drinks when consuming the above. They may also share some commonalities with cold dampness syndrome, such as being scantily dressed while being in cold places, especially during menstruation, or even washing and wetting up your whole body. Figuratively, this can be related to all that gooey stuff that accumulates in drain pipes in your kitchen and in your bathroom. Similarly, when this stuff affects the female reproductive organ, there is viscosity. So one has to figuratively throw hot water or drain cleaner down the pipes to expel the goo accumulated there. Symptoms manifested are obesity, viscous vaginal discharge, a feeling of heaviness, nausea, dizziness, sticky stools, delayed menstruation, amenorrhea, dysmenorrhea, and a tongue that looks like it's coated with a mixture of oil and flour. Some useful herbs to address this syndrome are sargassum, that's a seaweed, nutgrass, mustard seed, elaichi, called cardamom. Pathogenesis number 5, stagnated blood. This indicates there's a problem with blood metabolism and it's not flowing well. This is not to be equated with what is known as blood circulation in Western medicine. Symptoms manifested are dysmenorrhea, menorrhagia, with numerous clots, sexual pains, hot flashes, ecchymosis, that is black and blue marks appearing on the skin randomly. This is akin to a massive surge of current that disrupted the incubator and shuts down everything. Another way of seeing it is to imagine hair or debris getting down into your drain pipes in your bathroom. Nothing flow. This syndrome is regularly seen in women who have had abortions, blood transfusions, and women who play contact sports like boxing. Blood-moving herbs are needed here. Matroot, daisy, vervine, mother's wort are recommended. Pathogenesis 6, heat retention in the reproductive area. This indicates the womb is too hot. When the sperm is ejaculated into the female reproductive organ, it's as if it fries, and fertility is difficult to come about. Once the temperature is not right, there will be no babies. With an incubator, there's temperature control. No such thought is given to pregnancy. Symptoms may include thirst, a love of ice, always feeling warm, love of coldness, hot flashes, deep colored urine, heavy perspiration, dysmenorrhea, early menstruation. This syndrome is seen in women who love foods and drinks that are predominantly hot, like alcohol, lots of spices, lots of fried food. Some useful herbs are St. John's wort, poi bhaji, fat pork leaves, parsley. The samples of herbs given in the respective categories above are just a few of what is given and the principle behind their usage. These herbs are always used with many other Chinese herbs to form a comprehensive treatment to address the respective symptoms and diagnosis. So you can see There's diagnosis and treatment. No one size fit all, no vice approach. There's method, there's thought, there's common sense. So, I've just gone through the pathogenesis of infertility. There are simple and straightforward causes. However, clinically, it is not always so simple. Syndromes often overlap, and it's common to see cold dampness occurring with blood stagnation or phlegm dampness with heat. So more often than not, a more comprehensive diagnosis and treatment is needed, and many herbs and other substances are employed. What have you learned from these two podcasts? When other systems fail, all is not lost. There are other schools of thought, other solutions, just as good, sometimes even better. This concept of diagnosis and treatment may be new and strange to many, but most women can relate to the different pathogenesis mentioned. That's why to simply say you have a fibroid or you need a clean out doesn't cut it, doesn't make no sense. It is common to see fibroids in some or all of the above syndromes that I've just mentioned. Fibroid is just another symptom, like you feeling warm or you're bleeding. That's all for now. As usual, I have to go, but I shall be back soon, Jehovah's willing, with more thought-provoking and enlightening video. Please like, share, and comment. For new ones to this channel, please hit the subscribe button. Your subscription is very much appreciated. Ciao, ciao, fino alla prossima volta. That is, until the next time.